but I'm still, fine. I don't have a fever. I'm going to the toilet. It is a little bit uncomfortable, but my gynae appointment is in 4 days' time. What do I do between now and then?
In pregnancy, you do have increased urinary frequency, so you pee a lot.
And how would I know that now this is not just pregnancy and I'm going to toilet a lot because of that, but I actually have a infection? What's the difference? Hi everyone, welcome back to ziRight Girls. Today we are doing episode 5. I am your host, Dr. Thalia Isaacs, and I'm here with my host.
I'm Dr. Tembelihle Masina, and today we are talking about minor infections in pregnancy.
Lisa, this is a very important topic as it can cause a lot of complications if not managed well early on in the pregnancy.
That's true, Thalia. So today we are only going to focus on two infections, upper respiratory tract infection and urinary tract infections, because there's a whole lot of infections that can happen in pregnancy, but just to highlight those two that are very common in pregnancy.
Mm-hmm. Especially the upper respiratory tract infections, or the common cold, as people like to call it. During this time, it's winter, it's colder, people are indoors more, we are around other people more, and we're in close contact with other people. So picking up infections, especially upper respiratory tract infections, is more common during the winter times. And during pregnancy, it can happen easier when you're pregnant. Lisa, can you maybe take us through the different symptoms of the common cold?
Okay, so the common cold, like you've mentioned, it's an upper respiratory tract infection. It's spread by respiratory droplets.
Mhm.
So most of the symptoms that you will experience involve your nasal region, your throat region. So you'll experience nasal congestion, a blocked or runny nose, a sore throat. There may be coughing, often if there's a postnasal drip that can lead to coughing. You may experience ear tingliness or earache, or also a fever.
Can we discuss what can be done if you think you have a upper respiratory tract infection?
Okay, so upper respiratory tract infections are a viral infection. Most of the time, if you are healthy, your body should fight off the infection by itself. What's important is to remain well hydrated, because you may be losing a lot of water through fever. Bed rest is very important because your body needs to recover. And yes, you can also take some medications during pregnancy. So for the fever and pain and body aches, you can take things like your paracetamol. You can get that over the counter. You can use vitamin C and zinc, which also help to boost your immune system, which will help you to fight off the infection. You can also use some nasal spray to help with decongestion. So normal saline is good to thins out the mucus, and it's also safe to use in pregnancy without any limitations. You can also use some antihistamines, but for that you may inquire from your GP or possibly your gynae as well, just to check the safety of which antihistamine to use in pregnancy.
Excellent. So it is possible to treat upper respiratory tract infections during pregnancy. In fact, the contrary of that, by not treating them, can actually lead to more complications and worsen the situation. So we don't want you to have a fever when you're pregnant, because fevers can release hormones, which then can make your womb contract, and depending on how far pregnant you are, and make you go into labor, you may end up having a miscarriage or having a preterm delivery. So it is important to treat your upper respiratory tract infection. And as Lisha has said, there are things that you can do over the counter or with the help of your GP or gynecologist.
So, Talia, when should a pregnant woman worry about flu symptoms?
Okay, so If the symptoms are not getting any better, that would be a cause for concern. Like you said initially, usually your body will fight off these symptoms on its own. The thing about being pregnant is it does decrease your immune system. And so pregnant women tend to get infections easier than the general population. They also tend to get them more severe than the general population. So if your symptoms are not getting better, then definitely seek medical advice or attention. If you have symptoms, the following symptoms: a fever that doesn't break, or feeling hot followed by feeling very cold, we call that fever and rigors, or hot and cold swings, or cold shivers, definitely. Any fever above the temperature of 38, definitely you should start seeing someone. If you have any like shortness of breath, difficulty breathing, even doing daily activities, just having a conversation and you're finding it difficult to breathe, then you should seek medical attention, whether it be your GP or a trauma unit or your gynecologist. Um, I forgot now. Oh, if you have cough that changes color, so like we said, most of these respiratory tract infections are viral, so you'll have runny nose with clear secretions, but if they change color to yellow or green, then you need to seek medical attention.
Okay, and are antibiotics necessary?
No, antibiotics don't help for viral infections because antibiotics treat bacteria. However, as I said, like if your secretions start changing color, then you might have what is called a superimposed bacterial infection, meaning you started off with a viral infection, you didn't get better, and now opportunistic bacteria have come and also join the party basically, and then it might be wise to add antibiotic, but this has to be prescribed by a medical practitioner.
Oh, okay. Thank you. That's very insightful.
We mentioned in our previous pregnancy video that urinary tract infections or bladder infections are very common in pregnancy. Can you tell us why that is?
Okay, in pregnancy, you've got pregnancy hormones, which basically make your smooth muscles or your muscles a little bit softer. So you've got the urethra, which is the pipe that leaves urine from the bladder
Outside.
externally, yes, which is a little bit soft. So it makes it easy for bugs or bacteria to go up into the urinary tract. And also with your hygiene in pregnancy, you do have increased urinary frequency, so you pee a lot. And when you wipe, you must just remember to wipe from the front to the back to avoid introducing bacteria from the anal region into the urinary tract.
You mentioned urinary frequency. The common symptoms of a urinary tract infection, how would I know that now this is not just pregnancy and I'm going to toilet a lot because of that, but I actually have a infection? What's the difference?
Okay, so when you have increased frequency due to a urinary tract infection, often the peeing is painful. So you experience more frequent peeing. It's often small amounts of pee and it's quite uncomfortable or even painful. Sometimes you may have lower abdominal pain or lower back ache, and sometimes you may smell the urine. Most people would experience those symptoms.
Okay, excellent. What can I then do? So now I've suspected that I have this urinary tract infection, but I'm still, fine. I don't have a fever. I'm going to the toilet. It is a little bit uncomfortable, but my gynae appointment is in 4 days' time. What do I do between now and then?
Okay, because in pregnancy, urinary tract infections can complicate and lead to preterm labor, I would suggest that you do go see your GP and get it diagnosed so that it can be treated. It's often treated with a simple single antibiotic and that is sorted out. And also remember to drink lots of water because you want to flush out the bacteria.
So, in summary, guys, please remember that when you are pregnant, it is easier for you to pick up infections, and infections can be more severe due to the pregnancy. There is so much that one can do while you are pregnant for common infections. For pain and fever, you can take paracetamol, you can take vitamin C and zinc. before and during your respiratory episodes to increase your immune system. Drink lots of fluid and get a lot of rest. If you are uncertain about anything, please seek medical advice, whether that be your GP, your trauma unit, or your gynecologist, as infections in pregnancy can have severe complications such as preterm delivery and miscarriages.
That's a nice summary, Thalia. Okay, thank you for tuning in. And remember to like and subscribe. And to keep us going, we like your engagement. Please ask us any questions in the comment section. And until next time, we hope.
What's